Brought to you by Diagnostics.
Diagnostics.
We girls bleed almost all our lives. But how do we tell that this is abnormal? How to figure out that if the bleeding is beyond the normal limit? Abnormal uterine bleeding or AUB isn't just a minor inconvenience. It can be a sign of underlying health issues that need your attention. But don't worry, we are here with Dr. Shefali Tyagi to break it all down for you. We'll discuss what qualifies as abnormal, the potential causes, and most importantly, when you should seek medical advice. So stay with us as we unpack everything that you need to know about AUB.
Abnormal uterine bleeding. That is one of the common presentation in our OPD. From young girls to women to older women, many of them will have this problem during their life. Now, what is abnormal uterine bleeding? Abnormal uterine bleeding is any bleeding which is outside your period cycle, is heavier than normal, or you have intermittent spotting in between, or you have any bleeding after having intercourse. That will be classified as abnormal uterine bleeding. And what are the reasons? The commonest reason remains hormonal imbalance across all age groups. In younger women, because their cycles are without ovulation, they are anovulatory cycles. The cycles start early, but the egg production starts late. So the hormones are not on track. That is why the young girls sometimes will not have periods regularly. And sometimes when they start having periods, it will not stop for 20-25 days, 1 month, 2 months. In that case, you must come and get checked by the doctor. In the younger age group, young women and women in 30s and all, there can be many other reasons for abnormal uterine bleeding. The other causes can be thick endometrium. It can be fibroids or small tumors of the uterus. It can be polyps or small growth in the uterus. It can be any infection. Sometimes it can be contributed by cancers of uterus or cervix. Then it can be because of any rapid fluctuation in the weight. If you suddenly lose 10-15 kgs, then also the cycles can get affected. There is a very common syndrome called polycystic ovarian syndrome. That is one of the commonest reasons in younger age group to have abnormal uterine bleeding. And if you start gaining weight rapidly, that also contributes to basically abnormal uterine bleeding. Sometimes it can be psychological stress, any trauma that you undergo. All these can contribute to you getting periods out of turn, intermittent bleeding, or heavy periods which are not stopping. So if you have these kind of problems, that your periods are becoming irregular, you are bleeding out of turn, sometimes it comes only in 7-10 days, in 15 days, or occasionally you have spotting in between, you must consult a gynecologist. Once you go to the doctor, there will be certain tests which will be done. The first one will be examination. Depends on whether you are sexually active, not active. Internal examination or a pulse speculum might be done, might be skipped if you are very young. And then the doctor might ask for an ultrasound. Ultrasound will help to rule out all these polyps, fibroids, any other growth, etc., which can contribute to the abnormal bleeding. Infection screen might also be taken if the doctor is suspecting any infection. Other causes like bleeding disorders, etc., can also be picked up by running some blood tests. So liver function test, your hemoglobin, any bleeding profiles like prothrombin time, etc., thyroid, all these can be done to check that any other reason for kind of, leading to the abnormal bleeding. Sometimes even the medicines can cause abnormal bleeding. People who are taking oral contraceptive pills, they can have these big breakthrough bleeding, spotting in between, etc., which can lead to bleeding out of turn. So all that medical history should be told to the doctor clearly, that what medicines you are taking. And sometimes it can be the other medicines which you are taking for your liver, for your psychiatric illnesses, for any medical disorders, which can also contribute to abnormal bleeding. Once the cause of the bleeding is identified, whether it's hormonal imbalance, whether it's a tumor, whether it's a polyp, then the treatment can be initiated accordingly. So if it's a polypectomy or removal of polyp can be done. If it is polycystic ovarian disease, you might need to be more active in your lifestyle, lose weight. Sometimes hormonal tablets are prescribed to put your periods back on track. If any infection is suspected, antibiotics might be required. So once we identify the cause, the treatment can be initiated. But the bottom line is, such type of bleeding should not be ignored. It's not normal, and you must seek consultation to find out what is causing the abnormal uterine bleeding.
I hope you got some understanding of this medical condition that might need your attention. Girls, empower yourself to take control of your health. Keep watching Talk on FITTAK.